Last part of Chapter 13 of Systemic and Local Infections will look at bacterial infections. Bacteria are single-celled organisms. Some bacteria live on or in our bodies and promote body system function. There are very few bacterial strains that actually cause infection, but these infections can be very fatal. The good news is we do have antibiotics that we can use to rid the body of bacteria. However, over years of being exposed to antibiotics, some bacteria have become resistant to the medications. We will look at two main bacterial infections in this section: Lyme disease and meningitis. Lyme disease is typically spread in a bacteria in deer ticks. Deer ticks ingest the blood of animals and humans, and these small ticks attach to a human skin and transfer the bacteria by biting them. This method of transmission is the only means of infection. People cannot spread the infection to others. The signature sign of Lyme disease is a red bullseye pattern rash that develops from a red bump at the tick bite. Although this sign is indicative of the disease, many infected athletes do not exhibit this bullseye rash. The rash may form approximately 1 month prior to other signs and symptoms, which include flu-like symptoms, joint pain that occurs bilaterally and at various body joints, and loss of extremity sensation and function. If our athlete exhibits signs and symptoms of Lyme disease and has been in a wooded or grassy area recently, we need to refer them to a physician. Lyme disease is typically treated with oral and intravenous antibiotics. Our second bacterial infection that we will look at is meningitis. Meningitis is an inflammation of the meninges that surround the brain. Meningitis can be caused by a virus or bacteria. Viral meningitis is typically mild, and the person gets well without treatment. Bacterial meningitis is a serious, potentially life-threatening infection that must be treated immediately. Bacterial meningitis is transmitted from person to person through saliva or from respiratory secretions when the infected athlete coughs or sneezes. The typical signs and symptoms that we see can develop rapidly and last up to a week. The signs and symptoms include severe headache, a stiff neck, fever, chills, nausea, vomiting, confusion, and sensitivity to light. Bacterial meningitis is a medical emergency, so we must call 911 immediately. Our athlete must be treated in a hospital with intravenous antibiotics. To prevent meningitis, there is a meningococcal vaccine to prevent bacterial meningitis, and it is routinely given to children. This concludes Chapter 13, but as you can tell, we will not be discussing sexually transmitted infections section of the book. Although these are important and we need to be aware of them, we do not commonly see them in the athletic setting. Most times, athletes will go to their primary medical provider if they suspect this is a problem. Please review this section as it may be on the quiz.